Hi everyone, welcome to today's video where we are going to be talking about my 12-week update and first trimester recap in total. I'm Connelly. Here on this channel we talk about all things lifestyle, fashion, and motherhood, and right now I'm pregnant, obviously, as you could guess by the title, and I'm due in October. I'm currently 13 weeks pregnant, so I'm doing my 12-week and before recap. Technically, the 13th week is still in the first trimester, but a lot of people just say it ends at 12 weeks, so that's what we're going with for this video. I am so happy to share that I have really turned a corner basically at 12 weeks, like a light switched or something switched, and I was already feeling so much better. If you were following along for my 2-week weight symptoms or my weeks 4 through 8 pregnancy updates, you would know I was really sick, a lot sicker this pregnancy than with my first pregnancy with Evangelina. So I'm just thrilled to be kind of turning a corner with that. It's not perfect, I still have rough days, but all in all feeling so much better. The nausea really came on at weeks 5 and I still get it. And I really am hoping I'm not early on saying I think it's decreasing, so let's keep that going. The heartburn has kind of decreased, and I learned if I take 1 Tums before bed, then I can kind of get through the night, so that maybe it's the Tums, maybe it's that it's gone away, I'm not really sure, but I'm gonna keep doing that because it seems to be helping. So the dizziness I had, as you'll recall from my last update video, I had really bad dizziness where I would stand up and everything would go black and I felt like I was going to pass out. Like I'd have to drop down to my knees really fast so that if I did fall down, you know, I was closer to the ground. And the doctor said that was potentially because I was nursing. And so with nursing, you need 500 extra calories. When you're pregnant, you need 300 extra calories. So they suspected that I just wasn't getting enough calories. And so between increasing calories and decreasing the amount that I'm breastfeeding, I'm only breastfeeding in the morning, and I'm not really sure if anything's even coming out anymore because we've been doing that for a little while now. So between those two things, I'm feeling a lot better. Some days it's better than others, but overall, again, that is much improved. My daughter Evangelina is going to be 14 months in a couple weeks, so I think that's a good natural time for her. She's kind of self-weaning, so I'm just totally encouraging that. I'm not doing tandem feeding or anything when this new baby comes, so I am highly welcoming her self-weaning, that's for sure. And I think back to the day of her first birthday party, and this was maybe, so I was 6 weeks pregnant, and that morning we got up, set everything out, and right before guests came, went upstairs and got sick, and I was like, great, this is gonna be how this day goes, but it ended up being fine. And then later, like a couple days later, we had a Target video shoot, and I was like, this is just not gonna go well, but it ended up going just fine. I got through it, maybe because the day was so busy and I was so distracted, that's why, but either way, it worked out. So I'm just happy that either I'm feeling better or figuring out how to manage the sickness better. And with my first pregnancy, I remember I felt better at 14 weeks. So I'm 13 weeks now, so that's a week ahead of schedule. So even though I was more sick earlier on, I'm happy that I'm sick for less time, if that makes sense. Finding the silver linings where I can, basically, at this point. The other symptom that has really increased is pregnancy insomnia. I had this with my last pregnancy also, but not this early on and not this frequently. Like, I'm just waking up in the middle of the night for fun. Like, I don't even have to go to the bathroom. I'm not hungry or anything. It's just like restlessness maybe. And it's April 13th. Yesterday was Easter and it snowed. So we've been a little bit cooped up in the house, and normally I walk every day, but yesterday it just snowed all day. We got like 6 inches or something here in Minnesota. So I'm adapting to making sure I get a ton of exercise because I feel like that helps with the pregnancy insomnia a bit. Maybe not enough, but it helps a little bit, which I'll take. So then along with the insomnia, I have fatigue. So it's just like not fair. No matter what I do, I try to get more sleep and then I'm waking up. It's like, yeah, okay, everything's working against me at this point. But honestly, I'm feeling better, so I don't care about the insomnia. So that's how I'm feeling physically, more emotionally and mentally. It's kind of a stressful time, or I should say it's a very stressful time to be pregnant because it's COVID-19 and coronavirus time, and so we're quarantined and things are changing with who they're allowing in the hospital to accompany a woman who's giving birth. Some hospitals aren't allowing anyone. Some hospitals are only allowing one birth partner, and once they go into the room, they can't leave, like my hospital. So, and that could change if things get worse or get better, of course, before my delivery, but in the meantime, the appointments are also different. So they're offering virtual visits and they're encouraging people to stay home, and they're also just doing less. Like some places are only doing visits at 8 weeks and 20 weeks, and then when you deliver. And I just can't imagine doing only 2 visits. So I've been trying to get my visits in frequently before my clinic potentially turns off the ability to come in physically, because then you can't have blood drawn, you can't have certain tests done that you might want done. And I know the testing, we had genetic testing done, everything went well, I'm so happy to report. And I know that the testing can be a controversial topic, like why get tested if you're not going to abort the baby anyway if something were wrong. But I watched this video of this mom who gave birth and she didn't have genetic testing, and her baby had Down syndrome. And she said not knowing that in advance kind of stole the joy of her giving birth and that delivery day. So she was like, I wish I would have known in advance in retrospect. So I just think there's so many unknowns. The more you can know in advance, the better. Same with gender. We already found out the gender. I'm so excited. I hope no one in my family is watching this, because if they ask me, I'm gonna, like, they might actually get it out of me. So we're keeping it a secret until we can tell people. By the way, because we're in quarantine and we really wanted to tell friends and family in person, we haven't told anyone yet that I'm pregnant. And so I'm already showing like quite a bit. Whoops. So when we come out of quarantine, it's gonna be really obvious. So I wanna find like a fun way under the circumstances to like show that, like reveal the pregnancy. Say we have a gift for you or something, and then like drop the box and be like, surprise. I don't know yet, we're still thinking about it, but this quarantine it keeps having a new end date, like they keep pushing it out. So we'll just see what happens. I can be very patient, but I also worry that someone could get sick, like a family member. And we want to tell people before anyone gets sick, you know, so that it's not bad timing to try to share exciting news. So I don't know, we're still figuring that out. So all in all, oh, and the other thing is I have asthma, which puts me at higher risk for COVID-19 or the coronavirus. And also when you're pregnant, your immune system is slightly suppressed so that your body doesn't attack the pregnancy, this foreign invader in your body, which makes total sense, but that puts me at slightly higher risk to get sick. There's just not a ton of data. I watched this really informative video by Mama Doctor, and I'm gonna link her below because I think she's really good, informative, and not fear-mongering, and not also under describing potential risks. The way I just really like her videos, is what I'm trying to say. So I'll link to her below. I hope you will check her out. Oh my gosh, another symptom, and I'm so out of breath. And as you saw, I'm only 13 weeks and I'm so big. Did you see my stomach? It's huge. It's so big already. I just found a picture in my phone of 13 weeks last time, and I was like, ah! Like there was nothing there. I was like pushing and like trying to make something stick out. It looks like there is nothing going on in that picture. I'll see if I can figure out how to edit that in to compare first pregnancy versus second. It's just so true what they say, that you pop so fast with your second when your body just knows what to do, and it's like, I'm just gonna push this all out so that you get nice and big right away. There's no hiding it, baby. Basically is how I feel. So yeah, That's just another symptom. Oh, and I'm super out of breath all the time. It's probably a little bit of the asthma mixed in with pregnancy, but still, it's just a struggle, as you can hear. I can already feel it move. It's so sweet. I love feeling it. And the last time I was pregnant, I started feeling it around 14 weeks, or at least identifying what I was feeling in there. And this week I started feeling it, or this pregnancy rather, I started feeling it at like 12 weeks, maybe even earlier, which is crazy, but I know exactly what to, feel for. And it happened right after I drank sugar, which was what caused the baby to move around last time. So yeah, I know what I'm feeling, and it's definitely a little tiny baby kicks, and it's so cute and sweet. Yeah, we had the ultrasound, so I'm gonna go grab that really quick. So here are ultrasound pictures. We had a big old roll. Let me find a good one to share. This one is like so cute. And then one really cute one had its legs in the air. I don't know if you can tell, but it's like doing a handstand in there. It's so funny. So the baby was moving and shaking all over the place, and it was like so cute. So I'm so happy. Oh, another thing about the ultrasound is that I was so sick so early on, and that did not happen with my first pregnancy. So I thought, maybe, are there two in there? Could this be twins? And all of a sudden one day I went from being super, super sick to just like a little bit sick, which is really weird because I was still so early on. I was like 6.5, 7-ish weeks, and usually you don't like switch like that until the second trimester or until like 12 weeks or later. So I was like, oh, maybe something happened. Like I was worried then something happened. So we went to the ultrasound, and I had this weird extra black mark. I wonder if there's a picture of it next to the uterus. And basically what it is, yeah, I don't see it on here anywhere, but you can see maybe oh, here in this top one. So here you can see like this extra black mark, and they called it a bleed. So basically you can have like implantation bleeding, but I was like, could that have been another baby? Like, could that have been a vanishing twin? And they're like, we'll never know, but it's possible. Like, that is something that it could have been. So I kind of have a suspicion maybe there were two in there. I'll never know, but interesting to think about. And so at our 8-week appointment, they said at 12 weeks, that's probably going to go away. Don't do anything rough in the meantime because it can like cause a bleed, and you don't want that. It could be bad for me or the baby. So at the 12-week appointment, it was still there. So they're like, continue not to do anything too rough until the 20-week ultrasound, so that they can see how it's doing then too. Not that I'm horseback riding or anything at the moment, but yeah, just good to note. So that's it for my 12-week pregnancy update. I hope you'll follow along, subscribe, like this video, and we'll see you for the next ones. All right, take care, everyone. Bye.